child born in 1900 in the United States had a life expectancy of 49 years. A child born 100 years later, 2000, 77 years. That's a gain of 28 years of life expectancy against a baseline of 49 years, and it's attributable to the healing professions. The history of medicine is a history of progress. With each generation of physicians, we find new ways, better ways, demonstrable advances in medical science, new treatments, better outcomes, better caring.
When I was trained, if you had a heart attack, you lay in bed for 6 weeks. And then you got home, and then you'd have to rehabilitate for 6 months just to get over having been in bed for so long. Now we can treat people so rapidly, they barely have any heart damage, and we can send them home the next day. We've come such a long way in the practice of medicine.
I remember the first time I extracted DNA, and I ran it on a gel, and I looked at it under UV light, and I could see a band of DNA. And I remember thinking, this is real. DNA is not some theoretical substance. It is real. I can see it right in front of me. It was amazing. And suddenly I started thinking about all of the possibilities of what that meant.
There was a study I remember that one of our professors quoted us during medical school that said every 7 years from the time you graduate from medical school, 50% of what you've learned will be obsolete. So it's a totally different world than it was a few years ago.
The very first day, I learned how to do a high-quality neurological exam, which is really what makes a neurologist, is to be able to examine a patient's nervous system. And it was like a burning bush. There was no turning back. I knew at that moment that I was destined to be a neurologist, and that was why I did a PhD in neurosciences.
I had basically been doing transplants for 42 years. When I started in medicine, we still had to base our diagnosis and our exams on very little help from sophisticated laboratory studies, and we often had to make an educated guess of what was wrong with complicated patients. And now we can avoid those chemotherapies that are only toxic but not helping.
The pace of medical science continues to advance dramatically. I don't think that people appreciate just how fast clinical practice has come.
Physicians and scientists, continue to explore, continue to want to do it better. The overarching philosophy in stroke care is that time is brain. At Intermountain Medical Center, our average time to treatment is about 35 minutes, which is about 23 minutes less than the national average. So when patients get treated earlier, they have better outcomes, which means less disability. Our overarching philosophy is to keep the patient in their community when safe and when possible. Telestroke technology allows us to perform a high-quality neurological exam in any emergency department. Telestroke, most simply, is providing an emergent consultation from a neurologist about a patient who's having a stroke. This helps our rural communities by bringing the expertise of a stroke-trained neurologist into a rural community where a stroke may not happen, but once every few weeks or once a month. There's a few ways in which stroke care is advancing over the past 10 years. One is where the interventional radiologist goes up through an artery in the leg, up into the artery that's occluded in the brain, and then squirts a little bit of the TPA onto the clot. So the hope is that that breaks up the blood clot. It's called endovascular therapy for acute stroke. The second category is where the interventional radiologist puts a wire into an artery in the leg, then goes up to where the blood vessel in the brain is blocked, and then they can use a small vacuum device or a stent device or kind of a little hook to pull the clot out of the blood vessel. We have a central organization, we have a group of physicians that are pulling together to improve quality, to improve value.
What these advances mean to our patients is not only are we seeing lower incidence of heart disease, but if they have problems, the ability to rehabilitate people into a full life has been remarkable. The death from heart disease has dropped by a third. When a major vessel gets blocked, that's called a STEMI, ST elevation MI. In that category of heart attack, rapid opening of that vessel is life-saving. And by doing it in a rapid fashion, we can restore a person back to the way they were even before the heart attack. This is a huge amount of work that has to happen. You have to diagnose it, you have to get an IV, you got to get blood tests, you got to make the clinical decision, you have to get them to the cath lab, you have to do a diagnostic angiogram, you've got to find out where the vessel is blocked, you've got to put a wire down the vessel, then you have to put a balloon down the vessel and inflate the balloon, and the clock stops at that point. Now, in Intermountain Healthcare at all of our hub hospitals, McCady Hospital, Intermountain Medical Center, Utah Valley Regional Medical Center, and Dixie Regional Medical Center, our door, that means the time the person comes to the ED to when that vessel is open, we've achieved that in less than 90 minutes, essentially 100% of the time for all regions. And so we worked for 6 months with a multidisciplinary team of everybody coordinating and working through all the logistics to have a perfect process of care that's reproducible 24/7. And a lot of the time it's after hours and on weekends. Now, what's remarkable that no one else in the world has been able to achieve is we've done this for 4 years straight, 100% of the time. Every patient that presented with a STEMI to any of our 5 hospitals have had their vessel open in less than 90 minutes. And we're very proud of that. There's very few processes in healthcare that's that perfect, that includes so many handoffs and so many team members to achieve 24/7.
Something I've always been passionate about is taking scientific principles and applying them clinically for better outcomes for patients. That's what precision genomics really is taking basic scientific principles that are transformative and then trying to leverage those into better treatments and better outcomes for patients.
There was this paradigm shift that was occurring in the way we treat cancer. And we realized that genomics and precision medicine was going to be a big part of the future. When we're born, we have 46 chromosomes. 23 come from our mom and 23 come from our dad. We have over 20,000 genes in the human genome. So they tell us what color of eyes we have. They tell us how tall we're going to be. And there are also genes within that genome that control cell growth. We have genes specifically that are what we call tumor suppressor genes. So if we have a cell that's growing abnormally, then we hope that that gene is correct and does its job and stops that cell from growing abnormally. And if there's a mutation in that particular gene, that may tell that tumor to grow without a stop process. So precision genomics gives us the ability to intervene in those situations where we can to help avoid that or to help put a stop to that. We're sequencing the DNA of the tumor. The nice part about that is with that information, we can look and see which specific genes are altered to the point that that's causing or allowing a cancer to grow.
I would say the work really takes place in 3 locations. The first location is in the laboratory. We're able to get a patient sample, extract DNA from a biopsy, perform all of the chemistry and biochemistry necessary to understand what the genes are that cause that cancer to grow. The second place that then it happens is in computers and quiet offices as we pore over the results and try to understand what it is that these genes are telling us. And together, in a group of 20 minds, we pore over each patient's list of alterations and come up with a consensus interpretation about what that means. It's very, very powerful. And then the final third place where this work takes place is at the bedside in a clinic room with a patient whose family's there and they're suffering from cancer and they're searching for hope. And we take what's happened in the first 2 steps and we apply that to patients and we tell them about other treatment options that we can now consider and employ. And it's very exciting.
The beautiful part of it is there's been this convergence of science and technology and new medications as well that are available so that if we can identify that mutation, there may be a drug that helps to block that specific alteration and that specific mutation in that cancer and hopefully stop it from growing.
Translating science into medicine. That's what we're doing in precision genomics. That's what Intermountain Healthcare has a real skill at doing, and it's completely exciting and thrilling to be part of it.
We're here for the patients, their loved ones, for the lives that we can change, for the health that we can restore, the suffering that we can avert, the futures that we can create. That's why we're here. And frankly, we're as good at it as anybody in the world.